My name is Tina Rose, and I'm a women's healthcare nurse practitioner for many, many years. I was first introduced to nutraMetrix about 12 years ago by a physician colleague. At the time, I did not take advantage of the opportunity, however, because I was gainfully employed by a hospital group practice, and number one, I didn't think my employers would allow it, and number two, I had been there for so long caring for my patients, I honestly didn't think I would ever need a plan B. I soon learned, however, that that was not the case. When corporate medicine came and bought the hospital group, I found myself a casualty of that takeover, and I was out of a job. I decided the only way I was going to be able to care for my patients that I had built for so long was to open my own practice, and that's what I did. When I first opened my women's health practice, I realized that I couldn't spend time with my patients and earn an income. I had to choose one or the other. With nutraMetrix, I realized that I could keep my practice open. So my why when I first started the practice was to keep my practice open so that I could care for the patients that I've been caring for so long. For me, ancillary income is the only reason my practice is still open today. As I said, I learned early on that I could either care for my patients and spend time with them, or I could earn an income. I could not do both. And so with nutraMetrix, I have since built up my practice. Word has spread of the type of practice I have, caring for patients in a holistic way and spending time with them. And in the last 3 years, I have built up the practice to the point where I've been able to hire a medical assistant, moved into a brand new suite, and more recently hired another nurse practitioner part-time who is now able to contribute to the overhead of the practice and allows me to focus on my wellness programs and weight loss programs that I've since implemented. Since I've implemented a nutraMetrix custom health solutions into my practice, I've been able to keep my doors open, and I've been able to truly care for my patients the way I believe they should be cared for, not the way corporate medicine or insurance companies tell me I should be caring for my patients. I'm able to focus on their whole women's wellness and not just their body parts, and really help them achieve their optimal wellness, not just the lack of disease or the lack of illness. I feel that health professionals choose nutraMetrix for the same reason I did, as a way of keeping their practice open and not depending on corporate medicine to tell us how to practice. And I think there's a strong push right now amongst consumers for health and wellness. And since in the last 18 months, I've helped about 18 nurse practitioners actually open a nutraMetrix business so that they too can have their dream of owning a practice become a reality. I absolutely love all the nutraMetrix trainings, and I go to as many as I can possibly attend because I'm amazed by the wealth of knowledge that we can continuously get. I'm constantly amazed at the brilliance of our clinical director, Dr. Deidre Mason, and the wealth of knowledge that she offers us and the clinical staff that she brings to all the trainings. And one of my favorite memories, I guess, is when Dr. Deidre Mason asked me to participate in one of her online summit trainings that we provide complimentary to health professionals only. And that was just such an honor for me to be able to teach other health professionals what I have learned through the whole nutraMetrix system and the education behind it. nutraMetrix is changing the health of patients across America by focusing on optimal wellness, and no longer is health defined as the absence of illness. In the last century or so, we've really increased the lifespan of our population through technology, but unfortunately we have not focused enough on the quality of that lifespan. By working with healthcare providers in the field, we are really able to change the whole healthcare environment one clinician at a time, and so that now we as clinicians can start putting the health and the care back into healthcare in America.